This section on neural underpinnings of attention, I'm not super worried about all the brain areas because this chapter is so very, very dense to start with. And I think just hitting this high point about hemi-neglect will do. And to her credit, the author doesn't give a lot of detail on the particular brain areas. For example, on the bottom of page 98, one such network is a separate network also located in the frontal, parietal, and subcortical lobes is used to control attention. When you decide or are instructed to, for example, to look at the board in front of the classroom, you recruit the attentional system to disengage from whatever you were previously attending to and redirect your focus to a new stimulus or location. So brain areas in this network appear to be located in the frontal lobe areas, which we would expect. I think that's a take-home message. Of course, we're kind of familiar with the idea now that the frontal lobe is implicated in attention and working memory, and of course it would have something to do with attention. So that's enough for our purposes, and I think she made a good decision after the extreme amount of detail in this chapter that we just can't open up a whole nother topic of extreme detailed treatment of neuroscience and attention. So I appreciate that. Now, speaking of hemi-neglect, what's going on here? And the question is, if you have someone that fails to make an accurate drawing, and of course, very few of us would call ourselves artists, but for these patients, they're clearly neglecting half the image. And it's in such a way that reveals some sort of issue neurologically. In other words, they're not producing the left half of the image at all. So just to quote something here, clinical neurologists have documented the phenomenon of sensory neglect called hemi-neglect. And by the way, we're talking, this is attentional and not visual. In patients who have some parietal lobe damage, which could be a stroke or otherwise, these patients often ignore or neglect sensory information located in the visual field opposite to the damaged hemisphere, because you'll remember it's contralaterally located. I see things off in the right visual field, and it makes contact with the left side of the brain and vice versa. So if there's been some damage there, there's going to be some hemi-neglect. These patients often ignore or neglect sensory information located in the visual field opposite of the damaged hemisphere. Thus, if an area of the right parietal lobe is damaged, the patient overlooks information in the left visual field, as these people do. They're not absorbing information from that left visual field, and they're not drawing it. So the patient may, for example, neglect to wash one side of their face, neglect to brush the teeth on one side of the mouth, or eat only one from one side of the plate. In clinical studies, these patients have been studied in more detail. They are presented with stimuli and asked to copy them, and we could see that here. So the rhetorical question that I ask is this an attentional or a sensory issue? And it's attentional. It has nothing to do with their vision. It's what they're paying attention to as a function of these deficits as a result of probably a stroke. So just really quickly, and I won't belabor this, although the parietal lobe is one brain region known to be associated with attention, it's not the only one. And again, this hemi-neglect that we're seeing as a result in these drawings is a result of damage to the parietal lobe. But generally speaking, when we're speaking of attention, we're also talking about the frontal lobe, because that's where we direct our attention from as part of an executive function or a working memory sort of task. But so the rhetorical question below, it's attentional, and it has to do with information from one visual field to the opposite side parietal lobe that's not being processed and essentially not being attended to at all because of that damage. And these drawings, while crude looking, and they may look childish, are revealing something qualitative about that neglect. They're not seeing things, in this case, from their left visual field. They just cannot produce a whole image.